Everything is golden. Today, a special treat. How do I even begin this? It's very rare when you get a chance to speak with somebody who you credit for saving your life. And that is what I'm going to do today. Dr. Cindy Tutin is here. As I've talked about this on both the syndicated shows, that I had COVID and was literally at death's door. How do you know you're at death's door? Because you know and you're ready to go. And and I don't want to go into too much more detail than that. And I was at that point with COVID. I was at the point where I was checking out. And by the way, not unhappy, because it was such a miserable sickness, something that I have never experienced before, being that sick. And Dr. Cindy Tutin came to my rescue. I was one of those people that got the forbidden drugs. We tried Ivermectin the first time, and then later we tried hydroxychloroquine. And within Dr. Tutin, Cindy, it was what, about a day or two that I was telling you I was feeling great, better.
We're coming back. Yep.
Yeah. And with me, and the gentleman with us, is my new favorite friend, Dr. Gaston. Now, look, you have a French last name, and I don't want to screw it up. So, Gaston, tell us about yourself a little bit and your journey into medicine, and then we'll get specific with both of you.
Fantastic. So the challenging last name is Cornu-Labat.
Cornu-Labat. Now, see, I had it right, but I didn't have the pronunciation.
Yeah. But I do go by Gaston. It's a lot easier. So I am almost 40-year veteran of medicine. And my journey started as a general surgeon. Then I specialized in liver and pancreas surgery. I went deep into the academic world. And as I started gaining experience with patients, I started feeling that the information I had received from medical school was just one portion of the pie, not the whole pie.
Aha!
So I could not ignore that. So I went expanding into the principles of integrative and of holistic medicine. So today I'm a holistic and integrative medical practitioner focused on natural medicine and healing.
And those are some of the things that I want to talk about. First, I want to talk about, with you, Cindy, about your journey into medicine. Same question as I asked Gaston.
Sure. So I grew up in a family that appreciated nature, not just in how it's so beautiful, but also how it can help us heal. A beekeeping farm, and my mother would take us to a chiropractor more often than a pediatrician for our colds and such, and we found that it was useful. So I grew up friendly to natural approaches to things. But then I figured, well, I'm going to become a rehab medicine doctor so I can be a sports medicine physician, because I love sports, running in particular. And so after I got out of college and went to med school, specialized then in rehabilitation medicine, and found out that I make a great team player. And that's what I like about rehab medicine, is I'm just one of several people contributing to the purpose and direction of the person who's the center of attention, which is the patient, back in the day when I called patients. So did that for 32 years, and then COVID hit. Let's say I was not mentally, emotionally prepared to see the betrayal at the level that I felt it was occurring in mainstream medicine, because I also had along the way 5.5 years of research experience in pharmaceutical ways of looking at substances. I had not done any research for vaccines, if you will, but I had enough experience with even Pfizer, for instance, working on a couple of studies for Pfizer, that I knew what legitimate research looked like. And so when I saw the shots rolling out in such haphazard way, if you will, and them openly saying it's an experiment, I was like, you're right, it's an experiment. And so when things started just happening right and left with the COVID crisis, I realized that there was unfortunately, some nefarious, and I thought nefarious intentions behind the massive movement of this is the only thing you can do. That was the primary complaint I had. It was not giving options. You were just told, the general population was told, there's nothing we can do for you except, when you get COVID, except for you to go to the hospital when you can't breathe or you're blue. That was wrong. And, I heard from several colleagues, I would call them, like Pierre Corey, talking about Ivermectin. James, that's who I would credit for giving me the wherewithal to help you, was hearing from people like Zev Zelenko and Pierre Corey and the like. So, I got off of the mainstream train, if you will, recognizing very comfortably that it was a hybridization of my specialty now in rehabilitation medicine. So I became very comfortable in helping folks with acute illness such as COVID, flu, things like that. And I did a ministry, an off the radar ministry. I was not part of America's Frontline Doctors, although I was on their Telegram site. And so I learned a lot very intensively, sink or swim kind of approach to helping people. And God provided that I had a ministry, and then got into another ministry called Frontline Community Care Network, mainly getting the word out that there's not just one way to managing COVID, and it's not just the shot. There's lots of other options that God has blessed us with, and we should pursue that.
Now, I want to stop there for one moment, because this is vital to me to mention this, Cindy. You spent hours with literally hours, not just with me, but with my family members when I was sick. Hours on the phone. You checked in day, night. It was you can call anytime was the message. I don't care if something's going on. Every single day. And then I was aware that there were some other people that in my orbit that had COVID, and you did the same for them. Not once did you ask for a dime. This is unbelievable to me. There was no discussion of payment. There was no discussion of money. You have never discussed money with me. I, of course, felt compelled, and I will compel, and anybody that does this, you have to donate to the cause to me if you're doing it, if someone like this, but money doesn't enter into it. It never entered into it at all. This was about helping people. This was at a time when America's doctors were frightened to death. Those that didn't agree with that one approach, people had their licenses threatened. People were tossed out. There were people, medical professionals, tossed out of the industry. There were medical professionals that were not allowed to speak on social media. They were censored on social media, by the government. So let me just stop there and ask both of you. I heard the other day Robert Kennedy Jr.'s, his name escapes me at the moment. He's acting as sort of the undersecretary of HHS. That's not his official position. He was doing an interview and he blasted the AMA as pretty much, and I'm paraphrasing, being run by lobbyists and not really being concerned with American medicine. He blasted the lobbyists for poisoning America's children with carcinogens in foods, and they're vowing to take care of the foods. What do both of you say about the state of American medicine and the architecture of the infrastructure of American medicine?
Let me take on this one.
Sure.
Okay, so yes, I'm trying to figure out where to start, because this is quite a long discussion and a beautiful subject, So what I'm going to describe a circle. So a circle has no beginning, no end, right? But for the description, I have to start somewhere. So what we know today as the conventional medical system, or wrongly called traditional medical system, because tradition talks about oral passing of millenary old information, and there's nothing traditional about conventional medicine. Conventional is more appropriate to describe it because it's by convention, by agreement, that we reach the system that is currently prevalent, right? And this system is a system that is based on a few principles that in practicality add up to a system of disease management. And the system of disease management, and I will get to explain that, is a consequence of not being able to address the root of the problem and consequently not being able to cure the process. And this is a tricky concept to grasp, if you want. But let's use a simple common situation, which is hypertension.
Okay.
High blood pressure is a common thing, right?
Yep.
And there's two types of hypertension that we were taught in medical school. One is hypertension that is caused by some rare mechanical vascular conditions, such as narrowing of the renal artery, for example, that leads to a mechanism that makes the blood pressure go up. And those altogether may be 5% of the population that has high blood pressure. Then you have 95% of the population that has high blood pressure that we were taught is essential hypertension. That's the name. That's what we are taught. And essential hypertension implies that high blood pressure is part of your essence. That is essential. That is part of your makeup. So kind of when you get old, your blood pressure goes up and that's it. So if part of your essence, part of your aging is that your blood pressure is going to go up, so obviously you need something to bring it down.
Mm-hmm.
So the approach, the allopathic approach, the pharmaceutical approach is to introduce an element that will produce a counter effect to that essential process within you that is raising the blood pressure as you age. So allopathic medicine, introducing a counter effect. So then a medication comes in that produces the counter effect and lowers your blood pressure despite that essential drive to have it abnormally elevated. So this is how I understood blood pressure until about 14 years ago, when I started my apprenticeship with Jonathan Wright, who was one of my most influential teachers, who is a medical doctor who has been doing nutritional and natural medicine all his life, so almost 45 years. And one of the first things he says to me is like, there's 5 reasons for the blood pressure to be elevated. One is an imbalance in your sodium-potassium ratio. Second one is insufficient, inadequate level of vitamin D. Another one is deficiency in magnesium. Another one is metabolic syndrome. And another one is a misalignment of the occiput with the atlas, the first vertebra. And that one is fixed by certain chiropractors that specialize in upper cervical. So it's like, okay, interesting. But as a matter of fact, as I went experiencing and being able to see his experience, large number of patients that come with that diagnosis of essential hypertension and they come medicated, right? You start looking for these things, you start finding them, you start informing the patient about it, and the patient starts working, for example, and there's let's take vitamin D. Vitamin D came up in a couple of research studies that were published in mainstream medical journals, where the pathway that correlates cholecalciferol, which is the vitamin D, with the hypertension pathway was found to be correlated. So higher the level of vitamin D, the lower the stimulation of that pathway that leads to increased blood pressure. So the conclusion on that study was we need to develop some synthetic analog of vitamin D to start treating blood pressure. No, the conclusion was, the logical conclusion would have been, okay, so let's tell patients to optimize the level of vitamin D, so there's not an issue. The guy, and he was so tell-telling.
So wait. The conclusion is not go outside and get sunlight every day and enjoy your life in the sun and get natural vitamin D. Let's come up with a synthesized.
And I swear over my kids that was in the paper's conclusion, right? So the point is that once you start addressing these elements, suddenly that essential hypertension is not such. Mm. So do we really want to label everything as things that happen and that need a countermeasure? Or are there deeper layers that allow us, and here is the other element I'm going to introduce, allow us, meaning the practitioner and the patient, the recipient, who's really the driver, to sort out things so that through the introduction of changes in lifestyle and gentle natural medicines to help correct whatever the underlying cause is there, to really change the diagnosis so that that diagnosis is no more. So, and here comes the other element. Why do I mention us? There's a fundamental tenet that has been disregarded by the conventional medical system, is the fact that I, as a doctor, cannot heal you. The healing is a process that comes from within. And I speak this with almost 40 years of experience and consequent authority. So I'm not making this statement very lightly. And I have been inside patients' chests doing heart surgeries. I've been inside patients' chests removing lungs. I've been inside patients' bellies doing all sorts of crazy emergency or planned surgeries. I have many years of experience in intensive care unit, and I have many years of experience then in the outpatient setting, working from a completely different angle, informing and empowering my patient to move into healing that comes from within that particular patient. So I know as a fact that I can do some marvelous things like many of our colleagues can do from their wonderful and very important experience. But all those elements are tools, are facilitators, are elements that come in to make a difference, no doubt. Very sharp tools, very efficient tools, but tools nonetheless.
Got it.
And those tools don't heal. They help the healing that comes from within.
I love that. All right, now let me turn and just play skeptic for one moment with both of you. I love the idea of I started to say new age because that's just what comes to mind, but it's not new age. You said natural healing. It's not new. This has been, these sort of remedies have been around, plant-based remedies. In fact, a lot of pharmaceuticals derive from plants, of course. And so anyway, the point is this: when you go down this road, you say, okay, natural healing, you can heal from within, you do all this stuff. Let me talk for a minute about the quackery. Because just like I said, okay, what's the deal with the current quote unquote traditional medicine? On the other side of the table, you have these promises that are being made. You have so many gazillion supplements out there that supposedly do everything from harden your to make it longer, to cure everything under the sun. And next week, and then there's some new therapy here. There's new therapies there. And people get confused and rightly skeptical because a lot of stuff just seems to be, let's just throw something out there, say we can cure this, make a dime, make a few $1,000,000 off it, and then disappear into the ether, and no one knows how to track you down. There's no guarantees on it. So how do you guide patients into a better place with a relationship with their doctors? Look, I feel fortunate. I have both of you. And so there is like this tremendous element of trust here, and we have spent time together. Most people don't get that with doctors. They don't have this relationship. So how do you guide people into this place? Cindy, you want to handle that first?
I will start off by saying I'm the newest one in this duet here. So I'm learning a lot from my colleague here. But I do want to say that when I first learned as a toddler, okay, maybe 9-year-old, not toddler, but 9-year-old, about the potency of honey for burns, I'm from a beekeeping family. So we were using honey for our burns and for our, incidental, accidental, from the smoker, et cetera, but also for our cuts. And then we had folks who were buying honey and royal jelly from my mom for their rheumatoid arthritis. Then they were also, every now and then, we'd have a person come by and say, heard that bee venom is good for autoimmune disorders like, say, rheumatoid arthritis or multiple sclerosis. And can I have some bees to try? And my mother said, yes, you can, but I don't know anything about it. And it worked. It worked in terms of helping the people to recover substantial function. For me as a rehab physician, it's predominantly about function. Okay, how are your systems, your heart and mind and body and soul working for you? How's that functioning for you? And so I could see the benefit of God's provision in something as simple as bee products. So that was my first exposure to the fact that there is legitimacy in natural supplements, if you will. However, you're absolutely right, including pollen. You're absolutely right, James. A lot of the industry has been corrupted, just like any professional line is corrupted by people looking to make a buck off of the vulnerable, if you will. Just because you're in natural health doesn't mean you are, as a provider or clinician, immune from that temptation, if you will. That I do believe that there's a good portion nowadays looking to take advantage of folks' naivete, if you will. And so that's why I'm learning more from Gaston and others like him about how not to be so naive in my expectations, and also to know the limits that he as a healer can provide, because as he said, the healing comes, it's on my lap, it's in my responsibility. The healing comes not as an independent, I'm just free and floating and it's all about me. No, it's about the divine creation. The beauty of this creature that God has made has the capability to know what is correct and proper for this being. So what works for Gaston may not work beautifully and perfectly for me, and that's my prerogative to discern. And that's up to me to discern. So with leadership, not only from Gaston, but my research and from folks like you, James, just talking, and honestly, prayer. I rely personally on prayer for my guidance. What is proper for me to be doing for this body that I've been put in charge of? So for me, it's not just about listening to what people are saying, but intuiting what is right and proper and the best thing for me as an individual in the sight of God, sovereign individual in the sight of God to do.
Yeah, folks, if you're listening and watching this and you are hearing about prayer and God and you're saying, wait a minute, these are doctors, what are they? I'm confused. Don't be, because this is one of the reasons why I loved Cindy, Tutin, and Gaston, because this whole idea that we are beings that also have spirit, that we are also divine beings, and that's part of the mix in trying to heal, is to recognize that, to recognize our creator, to recognize that we are but, if you will, drops of the ocean of that mighty. So do you find that there are many other medical professionals that are now starting to see this sort of approach and unafraid, I should say, to actually bring these into discussions with patients?
Yes, and there are well, waking up. Professionals are waking up, but more importantly, people, the market, the consumer, is starting to wake up, and that is then driving the demand, the supply, so to speak. So in market terms, this is happening, and there is a very, very significant shift that's taking place. But James, I want to go back to the very, very important question you just posed, which involves two things: discernment and vulnerability. And Cindy was sharing her take on discernment, which is a very valid take. And I want to add a little more explanation, because there are groups out there. There are people that take advantage. So they are betting, they are exploiting vulnerability. So where is that vulnerability coming from? And here it's a crucial point that I'm going to build a little bit of context to be able to answer properly. We were talking a minute ago, acknowledging the fact that the healing comes from within. And there is another important thing to take into account, that with whatever my body is manifesting today, let's say diabetes, I went to the doctor last week, he did a glucose test and I'm diabetic. It's like, no, sorry, you've been working on this for 3 decades, and now it's coming out in the open. But it's not that you became diabetic last week. It has been a process that has been building up until finally the last stage of the process manifests with what we call diabetes, right? So it's not that diabetes came to you out of the blue. It's I've been working myself for 30 years on a mismatch between what my body needs and what I'm giving my body, that builds up over time to lead to this end point, which we call diabetes. So with this, what I want to illustrate is that I am standing exactly where my feet took me. So I am co-creator of my reality that is manifesting today. And I can trace easily, if I have some insight and willingness to look within, I can trace, my history and how I build to this moment where things are manifesting. And this applies for 95% of diseases that affect human beings. So I am standing exactly where my feet took me. This is one tenet to keep in mind. Healing comes from within. I am standing exactly where my feet took me. There is a third thing that I wanted to mention before, but I flipped the order, so I'm sorry. But it's nobody is intelligent enough to be wrong 100% of the times. Okay? So, and this goes out to my colleagues that practice other ways of doing medicine. Okay? I embrace everything. I embrace everything so long as we call it for what it is. Right? So this is with love and respect for all my colleagues. Yet, healing comes from within. I am standing exactly where my feet took me. So if I don't like where I'm standing, and it has been my power that has taken me here, it means that I have the power to go stand somewhere else. I just don't know how. So then, if I acknowledge that I have gotten here in my power, this is a statement, well, of empowerment, where I then acknowledge that I can stand somewhere else. I just need to figure out how to get there, because I did the best I could. This has been my life, it's been my journey with the elements I had in hand. This is where I'm standing. I don't like it. Okay, I can go stand somewhere else. But this is very different from saying, I don't like where I'm standing, somebody fix it for me. Okay? Because if my attitude is a complete detachment from the responsibility of my co-creative process and my manifestation, and I want somebody else to fix it, then this is the opposite. This is disempowerment at its highest expression. And the moment I disempower myself, then I become vulnerable. And that is where all the jackals that are out there waiting for vulnerable prey, and they will always be there, well, they take advantage of vulnerability. So the bottom line is, what is my attitude in my life? Do I want to take ownership and responsibility for my journey? Because I am the only one that can take the journey. Or do I want somebody else to fix it for me while everything else remains the same? So I want somebody else to do the journey for me, who really nobody else can do it. So if you start, we're starting to come full circle now, because if my attitude is somebody fix me, somebody save me, I give my power away and I put it in the hands of somebody else, which is, well, the doctor in this case, right? I disempower myself. I misplace the power in somebody else, but we know that the healing comes from within. So somebody on the outside cannot really heal me. So here, as a doctor, now I reverse.
Okay, before you go there, let me just stop you right there, because there are, look, oh man, I guess I'm going to start revealing all kinds of stuff. Let's say you walk into the office one day, the doctor sticks that finger up where the sun doesn't shine and says, you have a problem here, okay? And like you say, okay, you may have walked the thing and you're standing in the doctor's office with your drawers around your ankles and feeling very uncomfortable. But it's like, okay, I didn't get here. I can't trace how I got here. I got here and I'm here. And then they tell you, okay, now we got to do a biopsy. And you have a lot of experience with cancer. I happen to know that, doctor. So, okay, I got to do a biopsy. And the biopsy comes back, and then they bring you in the office with that sad look on their face to say to you, gee whiz, yeah, you have cancer. And you can't trace how you get cancer in some part of your body that you can't even feel until someone else puts a finger on it. and which, by the way, ain't pleasant. And then on top of that, they say, okay, you have two choices. Here are your choices. You either go radiation or you go surgery, one or two. Now, you tell me how all of a sudden you're empowered to heal within. You are scared shitless. That's what you are in that moment. You have no idea whether you're going to die if this thing turns super aggressive, which is known to happen. And you don't have any knowledge of the medical profession to say, where do I even start to research this? I don't know. I don't know what I'm doing here. So you look for a doctor, and you are saying, cure me, because I don't know what the hell to do here. So how does all this relate to what you just said?
This is a fantastic point, James. It's a great point. So, number one, you ended up with that finger up there because you took the initiative, right? Even if you didn't know, you took the initiative to go find out what's going on with your body. There's some aspect of your body that you're not in tune with. You cannot sense it. Something led you to initiate. So you're initiating. Now, when you initiate, you suddenly find out that somebody is walking you through a path that's very specific. And you clearly said at some point in your description, say, oh, you have two options. Well, there are steps before that, right? But at some point, the doctor, after they tell you, okay, this is enlarged. Okay, you need biopsy. Okay, two options. So somebody has laid a path for you. Now, that somebody, which in my opinion, that's why with full circle here, no beginning, no end, no blame on one side or the other, but it's a circle. Because that doctor, you know what the etymology of the word doctor is? It's it comes from the Latin docere, which is to teach.
Mm.
So a doctor is a teacher.
Mm.
And a doctor should, this is how I approach this. Okay, so I'm going to put myself in the urologist's shoes and extrapolate from how I deal with my patients. I would say, James, let's use you as an example because you're there on the other side, right? So, James, your prostate is enlarged. This means that it could be a benign prostatic hyperplasia, could be a focalized area of tumor. Cancer is very common as we age, so it could be a cancer. My knowledge and my area of expertise is as follows. I can help you with taking you to an ultrasound or doing a biopsy and then recommending you treatment based on the results of the biopsy. There are other specialties, such as integrative oncology, where they consider cancer from a broader perspective and they address the issue from a different angle. So you're welcome to explore that if you're interested. This is what I have to offer.
Okay.
So you see, there's a completely different way than creating fear on you. And here, a friend of mine that passed away 2 years ago, great communicator, a guy from Hollywood, actually. Peter Starr was his Hollywood name. Graham, what was the famous Scottish, I forgot his last name. Famous Scottish that came out in a movie, Rebel from the 1300s.
You're talking about William.
Yes.
Yeah. William Wallace.
William Wallace, thank you. I couldn't
Braveheart.
Sorry, Graham. Graham Wallace was his real name, but Peter Starr. He published an extraordinary documentary in 2011 based on his experience dealing with prostate cancer. All the steps you describe, he addresses them beautifully. He found himself exactly in that situation that you described as an example. And he managed his disease on his own terms for 18 years until he passed away. And of those 18 years, 95% of the time, he was just fantastic and went on with his life, kept doing movies and stuff. Peter Starr, great example to answer these with a practical experience. But the point is that if the doctor is doing the job correctly and is teaching you part of the art, and in my opinion, the obligation we have as practitioners is to, first of all, be able to pick up that you happen to be ignorant about this, which is okay. It's part of being diseased, being a patient. A patient doesn't know the solution. If he knew the solution, he wouldn't be a patient. So my responsibility is not only provide, based on my experience and expertise, a path to resolve the issue, but also educate. And in that process of educating, I am empowering the individual to make the decision. Because if you, after you do your research and you assess your situation, your decision, not out of fear, because the fear mongerer is pushing you, but out of your informed consent, if your decision is to go through a biopsy and then go through a surgical excision of the prostate or radiation or whatever you choose, then it's your decision, it's your path, it's your healing. And if we ever look into this factor that I just mentioned, which is the true informed consent, where the individual is the one choosing out of all the menu, I'm willing to bet my motorcycle, which is one of my most precious belongings, that we would find a clear pattern establishing true heartfelt decision, not out of fear, but out of true informed consent, a decision with a correlating extremely high with positive outcome, no matter what you choose as an option.
Interesting.
Because then it is my journey, it's my healing, it's me deciding, not being manipulated, not being convinced, not being pushed, but me deciding to take this option because it's the one that fits my process the best. This has correlated very clearly in my experience. So that's why I'm willing to bet the motorcycle. We would definitely find a very strong correlation with outcome, with favorable outcome, no matter which choice.
Wow. Cindy, let me do this. We are running out of time for this segment. Here's what I want to do. Number one, with both of you. We haven't even scratched the surface, number one, because I do want to talk about in future episodes with you too. I'd like to talk about some of the new treatments that people are finding for illnesses, for diseases that they may not know about. And I preface, that's one of the reasons why I'm glad today we started talking about, we addressed this issue of the quackery and the other stuff, because I want people to have a framework when we start talking about new things that can come onto the market. And then, Cindy, I just want you to talk for a moment about, you did a blood test with me, and I have never seen this up. Well, ladies and gentlemen, what happened, Cindy and Gaston, both of these doctors were in my house. This is the relationship that we have, right? So they came to my house to show me something about me. And what she did, Dr. Tutin did, was draw a few drops of blood, put it on a microscope, put the microscope on the big TV, and then started explaining everything from this one drop of blood. Now, if you've never seen a drop of your own blood up close, I will tell you this. It's amazing because what you see is your blood is alive. It's alive. It's moving. It's doing things. And there are other things alive in just this one drop inside of you. And it's stunning to look at this and then understand that this body that we're in, a simple drop of blood. And I mean, come on, people know this all the time. That's why we do blood tests to see what's going on. But it's just stunning when you see it. And Dr. Tutin, you did this by way of looking at other things. So I just want to wrap up today with you just kind of giving us your overview on what is possible and what you're looking at being possible. And then I want to reconvene with both of you at some point, and let's start dialing down into specifics into what this holistic alternative way of looking at medicine is. Cindy?
I need to tell you about the live blood because that's what really put me on fire and on the trail of this holistic integrative approach. I'd heard about integrative medicine since I was just wet behind the ears as a medical student, but devoted my time to the rehab direction, which was well and good, had great experiences with that. And then all those years of ordering as an attending physician for a rehab unit, CBCs and Chem 7s and Chem 12s and liver enzymes as a separate thing. Anyway, all these blood works and urine and sputum and stool, etc. I've never heard that I can recall something called live blood assessment or live blood analysis. It used to be called, and still is to some degree, but it's taking a drop of blood as it's still circulating through your finger, just like looking at your blood sugar. As you said, James, put it on a slide under what's called dark field microscopy, so you don't have to add any agent such as a dye to be able to see these cells and components of the blood pop off the slide up onto the big screen. And you can see the dynamic life is truly in the blood. And of course, throughout many of our other organs, every one of our organs has life as long as we're breathing and our heart is beating. However, and you know me, I have to go to scripture, James, Leviticus 11:17, that has a reference to the life is in the blood, that the Creator put life evident in the blood. So it made sense to me that live blood examination would reveal a lot about the life of the individual. So I actually went based on a recommendation of my friend Tom O'Tork, whose setup we're using right now to be able to do this podcast. So he asked me to come look at his being done, his live blood audit being done by a woman that I cherish as a mentor. And when I saw the example of what you can interpret in terms of health of cells, tissues, organs, the entire being, I was very impressed. But I was not nearly as impressed as when I went back the next day and my own live blood assessment and examination was done. And I couldn't deny that what I saw on the screen came out of my body. And I now realized what 40 years of what I thought was irritable bowel syndrome was about. I figured out with her help and explanation and direction and guidance, like Gaston is saying, teaching me the part that I had played for my feet to take me where I was standing right then. And I thought it was old age. I thought it was menopause that was causing my stiffness of the joints and difficulty going back to the jogging that I used to so enjoy. But because my ankles and my knees hurt, I hadn't been able to do that for a few years. Well, I made some adjustments, quite simple adjustments based on the live blood assessment that was done that afternoon. And in 3 days, I could jog without pain for the first time in 3 to 5 years. So it moved the needle. It bumped the direction. So I would say not that that was my aha necessarily moment, my eureka, but God used that to say, there's a different way you can go. And Cindy, if you can go this way, because like other things, I try the ivermectin on me first. If I can go this direction and find benefit and utility out of it, then good Lord knows others can too.
Wow. Well, guys, we're going to leave it there for today. As I said, I hope that you will continue to allow me to walk with you on this journey through educating, explaining, revealing more about what this holistic approach to medicine is really all about. And again, I just want to make it clear. I'm not here to tell anybody to do anything. And we're not, and that's not the purpose of this. This is an information. This is what's out here. As you said, Dr. Gaston, you decide what you want to do with information. You decide if you want to follow it through and look into it. We're not telling people what to do. We're just presenting different things. I tell you what, my eyes were opened when everyone else was telling me that pretty much you go to the hospital, get on a respirator, and hope for the best. And if I had done that, I wouldn't be here today. Cindy?
Thanks. One last thing I want to say, as my shirt implies, this is about freedom over fear. Not freedom from fear, but freedom over fear. The last 5 years, the driver in the seat for American medicine has been fear. Not just the last 5 years, but for decades. Fear has been what's causing us to seek and to accept without thinking beyond this narrow window of what we're being told by the teachers, if you will. So, the scriptures say 365 times throughout them, do not be afraid, fear not, be courageous. And so we're in an age where courage is rising up.
I love it. We will end on that note. Thank you so much. And I look forward to speaking with you again really soon.
Thank you. We'll see you soon.
Looking forward to it, James. Thank you.
Thank you so much.